Rain over snow on Monday. So this next one is fascinating. There's a clinical trial over at OU Health Stevenson Cancer Center that is showing some promise. It's to treat mouth sores caused by radiation and chemotherapy. The drug being used here derived from a pretty unique source. We're going to get into that in a second. But joining me now is Dr. Christina Henson. She's a radiation oncologist with the Stevenson Cancer Center. She's also leading the center's participation in this trial. Doctor, thank you for joining us this morning.
Thank you for having me.
So I mentioned those mouth sores. Can you talk about how those happen and just how painful those are for those patients?
Sure. So mouth sores are really common in patients undergoing cancer treatment, but especially patients undergoing cancer treatment to the mouth and the throat. We're treating them typically with radiation and sometimes chemotherapy, and this side effect is probably the toughest side effect on patients to handle. If you could kind of imagine getting a sunburn inside of your mouth or throat, that's essentially what it feels like. And so, these patients end up oftentimes taking pain medications, really affects their ability to eat and their ability to make it through treatment.
Oh, that sounds just absolutely awful.
Yeah.
So let's talk about this treatment here, and the unique source I'm talking about is deer antlers. How did you guys come across deer antlers being used to treat this?
Yeah, so OU was one of many centers participating on this trial, so we did not isolate the substance or invent the drug. It was a bigger company that did that, and I'm not sure exactly the story that lays behind it, but I do know that this compound has been used holistically for a long time in other countries. It's something that can be bought, kind of in the vitamin section at a much lower dose. So sort of like how aspirin was derived from tree bark and now is synthesized in a lab. That's the same for this compound.
That is absolutely fascinating. What are these trials showing so far? How effective is this drug?
Yeah, so far they're showing that the time to onset of this side effect in our patients is about 2 whole weeks later than it normally would be without the drug. And it's showing that these patients have less severe symptoms when they do have them. So this trial that we participated on was a phase 2 trial, so fairly small, and the next step is going to be phase 3 to look at it in a much larger population of patients, but it was an international trial.
Give us some perspective. How much of a difference could this make in the lives of those patients that are just struggling with these conditions?
Yeah, so the biggest things would be hopefully lower use of opioid pain medications during treatment, right, and all that comes with that. And then also lower rate of needing feeding tubes placed during treatment. So when people do get the really bad sore throat, sometimes they're just not able to continue eating by mouth. And so we have to put a feeding tube into their stomach temporarily. So it's not the end of the world, but obviously most people would prefer not to have to do that. So it could be huge for our patients' quality of life and their tolerance of treatment and their ability to make it through the treatment that's hopefully going to save their lives.
From a personal perspective, can you speak to the hard work and dedication that this took from you and your team over at the Stevenson Cancer Center? What was it like working on this and discovering, just how effective this stuff was?
Yeah, so anytime we do a cancer trial, it's more work on the clinical side because there's a lot of paperwork that we have to submit for each patient. This study itself was very rigorous. We had to take a really intensive look inside people's mouths twice a week during treatment, including photographs and measurements and things like this, and then, document everything we saw, send that to the study team. The study was blinded, so that means that we didn't know who was getting the drug or the placebo, and so was the study team that was running the whole trial.
Okay, so a lot of hard work.
A lot of hard work, yeah. Patients were filling out like daily symptom inventories for us that we were keeping track of too.
When do you think this will be available to the public? If you had to give your best guess.
If I had to give my best guess, I'd say probably another 5 or so years because the phase 3 trial is still in development, which takes some time. And then once it's open, it'll take a couple of years to complete that.
So it's going to take some time, but at least that hope is on the horizon.
Exactly.
All right. Dr. Henson, thank you so much for your hard work.
Thank
This
you.
is absolutely fascinating. Thank you for coming on and talking about it.
Thank you.
All right, everyone. 9:50.